Bringing home a little one is such an exciting time, but it also comes with plenty of safety concerns, especially when it comes to sleep. I know this firsthand from my toddler. Beside me is Elizabeth Biddle. She's a maternal and child health outreach coordinator for the Department of Public Health. Elizabeth, you've been talking about the numbers for this and taking a closer look, and it might surprise some of us.
Yes, it's very surprising to see that accidental strangulation and suffocation in a bed is one of the leading causes of infant deaths in South Carolina. It's now, children are more likely to pass away from a sleep-related death than a car accident when it comes to those who are 1 and under.
And I know your biggest message is this is preventable.
Correct. These are accidents that are usually in a sleep environment that is considered not safe. Maybe there's an infant in an adult-sized bed or on a couch. There's something that causes that accidental strangulation or suffocation in their sleep environment.
Okay, so let's say I'm a new mom, I'm bringing home the baby, or maybe grandma's watching the child, and sometimes grandma says, we do it this way back then, but things have changed.
Things have changed. The easiest way to remember safe sleep is ABC. You want the baby alone, that means just baby, in a crib on their back. So ABC, alone, back, crib.
Okay, I think I can follow that one.
There you go.
So folks are going to be traveling for the summer, and then you got to wonder, where's the baby going to sleep when we're traveling? What is your advice for that?
Absolutely. Just because we're traveling and on vacation, we want to keep those safe sleep practices going strong. If you are traveling, it helps to call a hotel ahead of time and see if they have a crib available, or maybe there's a pack and play at a Airbnb type rental that you will be at. You don't want the baby in the bed with a sibling or with the parents. You want them to have their own safe sleep environment.
So it takes a little bit of planning ahead, but certainly worth it.
Yes, that is definitely the way to go. We want to prevent anything from happening to your baby, and the best way to do that is plan ahead and think about their safe sleep environment.
Let's talk about co-sleeping, because room sharing can also reduce the risk of SIDS by up to 50%, but talk about safe room sharing.
Absolutely. So we like to say bed sharing, no way. Room sharing, okay. So bed sharing is when the baby's in the bed with you. That increases your risk of suffocation or strangulation. But room sharing, having a bassinet or a crib in your bedroom with you, keeps the baby nearby, so that way you're not traveling through the house for those midnight feedings.
Yes.
You have baby close to you.
Yes. You're taking me back to all my memories.
Oh, goodness, yes. You have baby close to you, so you're able to address those needs, and then once they have been fed or changed and taken care of, you can put them safely back in their crib.
And I'll also say, with a lot of social media influencers out there, make sure you're getting your information from a reliable source. Thank you so much for your time.
Yes.
We have much more to come here on Friends at 5.